Hello and welcome to Health Professional Radio. I'm your host, Neal Howard. Our guest in studio today is Dr. Josie Tenore, board-certified family physician who became interested in aesthetics during medical school. As a result, most of her electives focused on dermatology and plastic surgery. And she's here with us today as the owner of Fresh Skin, a wellness and beauty practice located in downtown Highland Park. She's here today to talk about anti-aging medicine, what anti-aging medicine is, and why she prefers to use the term life extension science. How are you doing today, Dr. Tenore?
I'm doing fantastic. How about yourself?
Doing well. Anti-aging medicine. What is anti-aging medicine? We see it on TV, these creams and these, shots, Botox, all of this considered anti-aging medicine. And why do you prefer to use the term life extension science instead?
Well, for me, whenever you start something with anti, it immediately produces a negative connotation. And I tend to be an upbeat, positive person, and I don't really like to sort of preface anything with a negative, especially when we're looking at what I consider treatments and modalities that make people feel as good as they look and look as good as they feel. So, anti-aging medicine was a term that I think, I did some research. It was first coined in the 80s. And it sounds still kind of 80s. It's used everywhere. And I think it's also overused.
Well, yeah, we hear it. I see it. I still see it a lot, and hear the term a lot.
Oh, yeah. It's like, this anti-aging cream and this anti-aging this and that. So to me, when I really look at what is it that we do day to day, what are patients really interested in? Patients really are interested in having longer lifespans. That's really, and having better quality of life. So that's kind of what patients are interested in. And as physicians are interested in trying to figure out ways to deliver this. And I think we have, for the most part, done a fantastic job over the last, 3 or 4 decades. If you look at sort of the age that most people live, it wasn't that long ago when people died in their 40s. And that was considered old age. And now people are living into their hundreds. So to me, I prefer either quality of life medicine or life extension science, because that's really what we're doing. We're looking at, what targeted therapies can extend somebody's life. Supplements can we take to increase our telomeres. So that's really why I prefer that term as opposed to anti-aging.
Now, you mentioned telomere. Explain, most of us our listeners are health professionals. Explain telomeres to me.
Well, telomeres are the terminal ends of our DNA. And as we age, the little ends can't get broken off. And so as our telomeres get shortened, our life sort of is shorter. And we actually do have tests now that can measure telomere length. There are some individuals who claim to have produced supplements that extend telomere length. I'm not so sure that we're quite there with science. We do absolutely, for a fact, know that eating healthy and exercising maintains telomere length. So all of the things that we have professed that we should be doing to have good quality of health actually does preserve our DNA. And so it allows us to live to the full extent that our own biological DNA is programmed for us to live. And we are really seriously looking at treatments that can actually take those telomeres and sort of make them longer so that we can have a longer life as opposed to just the best life we can for when our telomeres tell us we're not going to live it anymore. So that's what telomeres are. So
these telomeres, they are indicators or controllers of our lifespan and I guess the way that we look as we age. You're talking quality of life medicine. I'm assuming that a lot of the quality of life is how you feel, how you look, not just, your living condition or your financial status. What's the most common reason that people come in to your practice, as far as their looks are concerned as they're aging?
So my practice, just so we have a good overall sense, I have an aesthetic medical practice, and it combines cosmetic dermatology and wellness. So there's no question that the overwhelming reason that people come in to my practice is for Botox treatments. And,
Botox.
Botox. So, I call Botox the gateway drug. Just like in the 60s and 70s, our parents were so worried about marijuana because it was the gateway drug. It'll lead to heroin. So Botox will lead to other treatments. And it
Plastic
sort of does.
surgery.
But, and men are now coming, and I, jokingly say to them that I call it Botox.
Oh, Botox. So, like a bromance.
Botox. Yeah, bromance, Botox, just because it's becoming also something that men are doing as well as women, so it's no longer just for women only. But it's, bar none, it's the most popular treatment for a number of reasons. Number one, relative to, a facelift, it's extremely inexpensive. Anywhere from $300 to $700, depending on how many areas you need treated.
As opposed to thousands and thousands for plastic surgery.
Exactly. It's very easy to administer. I use tiny little insulin syringes. And so it's virtually painless because I ice the skin before I do my injections. And the treatment can last anywhere from 2.5 to 4.5 months. And some people, can actually get the benefits for up to 6 months. So given that it's, so easy, there's not a lot of pain, it's long lasting, and there is people are very satisfied with the results of Botox treatment, that it is really the most common treatment that I perform in my practice. And, while some of us would consider this sort of, a fluff treatment, having done this now exclusively for the last 10 years, I won't talk about prior to that. We used Botox for cerebral palsy in the 80s in children in very high doses, and it's been around a long time. But for the purposes of cosmetic, for the last 10 years, it's been the most popular treatment. I have to say that it can be life-changing. I've had patients who have come in and told me that, one simple little treatment completely changed their life. It got them out of their house and out dancing as opposed to being inside their homes and being depressed and not liking how they looked and not having the confidence to go out. So I do think that even something as simple as Botox can be an extremely powerful treatment for patients to have better quality of life.
You did mention that it was long-lasting. Is it fast-acting as well?
Well, that's highly variable. Some people will start to notice some of the benefits within a few days, but it does take a full 2 weeks for it to fully set. And so, I usually tell people, give it a couple of weeks. But as I said, some people I've had some people who say they immediately saw a difference. That's impossible. Well, you know what I've learned to say in medicine, nothing's impossible, but it's unlikely. It's usually more, 3 to 4 days it starts, and the full effects seem to manifest itself in a couple of weeks. So that's fairly fast acting to me.
Now, you mentioned, suffering from the depression that goes with deteriorating looks. Okay, so a full 2 weeks before it, as you say, sets, and then up to maybe 4 months, 4.5 months before you have to come back. If someone is suffering from depression, does the depression come back as the treatment wears off? Or have you noticed that people are saying, now that I know that I can reverse this look or this process, the depression has gone away? What is your experience with people's attitudes?
It's interesting. My experience, and then what the studies show. I'll address both of those because they are a little different. So in my experience, if we're sadness, let's talk about sadness. So if people are just sort of being upset with one's looks, if it's something that is more of a mood related as opposed to illness, then yes, by the moment somebody sees lines developing again or they're frowning again, and they know they can come back, they get treated, they maintain the less of the what we refer to as sort of the symptom or sadness, depression, as opposed to the actual illness. Because, we use the term depression as a term, oh, I'm so depressed today. So it's a term that we use sort of off the cuff, and then there is an actual psychiatric diagnosis, depression. When it comes to the psychiatric diagnosis, they actually have studied Botox in depressed patients, and they have found that individuals who do receive Botox treatments, their depression resolves better and it stays away longer, so they tend to relapse less. And the initial study was just, okay, so the thought was, well, if you can't frown, you look in the mirror, you don't look sad, that must tell your brain, hey, I can't be sad, and maybe that's the effect. I don't think we really know the mechanism of action. But then there was a follow-up study that I read recently, and I'm afraid I don't have that exact, journal, but there was a study that looked at, well, what happened after Botox wore off? And they did find that the depression, the illness depression, didn't tend to recur as readily. And so they are looking at doing further studies to figure out, why is this? Are there effects? Does Botox have an effect on neurotransmitters that we're not aware of, for example? Mm-hmm. We do not have answers to this, but it is an interesting and very promising area of medicine that we're looking at, because depression in some people can be a very difficult illness to treat and very resistant to, some of the medications that we use. So this is something that is being intensely looked at.
Where can our listeners get more information about you and FreshSkin?
Well, I'm located in downtown Highland Park in the northern suburb of Chicago, Illinois. Mm-hmm. I have a website, www.myfreshskin.com, or they can phone the office at 847-681-8821.
You've been listening to Health Professional Radio. I'm your host, Neal Howard. We've been in studio talking with Dr. Josie Tenore, discussing the term anti-aging and why she prefers to use the term life extension science. We've also been discussing her practice, FreshSkin, located in Highland Park, Illinois, and the reasons that people come into her practice basically to improve quality of life. It's been great having you here with us today.
Thank you very much, and I enjoyed speaking with you.
Thank you. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm, and you can subscribe to our podcast on iTunes.